Welcome back. So the recent fires at the Tembisa Hospital have angered the Public Servants Association. The group says there has been a clear pattern of fire at government buildings over the last 5 years. Aside from affecting key healthcare access, building fires have cost billions of rands over the last few years. But for more on this, let's speak now to Madimetja Mautla from the Gauteng, who is, of course, the Gauteng provincial organiser for the Public Servants Association. Mr. Mautla, good evening to you. Thank you so much for joining us. I mean, I could ask you about your reaction over the weekend with the fire at the accident and emergency unit, but I'm also, keen to hear then your reaction when you hear there's a second fire now at the Tembisa Hospital.
Good evening, Lady. Good evening to the viewers. Indeed, we are very disturbed about the spate of fires, not only in Tembisa, but in many government buildings that we have mentioned in our media statement. But this one at Tembisa, we feel that, and we strongly believe that is a result of negligence. Over the years, that hospital has never been maintained properly, not renovated. Glaring issues of non-compliance are ignored, and that is what we have a gripe with. We have warned them in December, and the Department of Labour and Employment was called to do an inspection. They did an inspection, and they were given prohibition notices and infringement notices, which they ignored. They ignored the recommendations of the Department of Labour. They have not acted on those recommendations. And from what we hear is that from the witnesses who were there on the scene, they say a ceiling collapsed and the electric wires sparked fire. But these are not confirmed because an investigation still has to be done so that we know exactly what happened. But we believe that it is just a result of gross negligence on the part of the management.
So you said you warned them in December. You're talking about the Department of Health, and what did that conversation look like? What are the particular issues and specific issues that you raised in December, and what was the response?
The building that burned, although it was fairly new, is one of the areas that was flagged by the Department of Labour and Employment in the report that was issued to the management. Theatre also had issues, and various other areas in the hospital, including the wards. When you walk around there, you see electric wires, live electric wires hanging. The geysers are not working. The patients and the workers are struggling to get hot water. They even have to use hands to warm the water so that they can assist the patients. So this put too much pressure on the employees who are working there because they still have to render quality healthcare services to the public. But their hands are tied because the hospital is not providing them with all the necessary resources to assist them to work properly. If I may also indicate that there were other warnings that they should have taken and be on high alert. For example, there is an employee who got injured when a ceiling fell on top of her head. That was around 25 February 2025 this year. The employee got injured. This shows that the hospital is collapsing, is falling apart piece by piece. We just had to fire on Saturday. 2 days later, there is another fire. This despite the Department of Health, Gauteng, ensuring the public that everything is in order. The hospital will run as normal. It is only casualty that is on divert until further notice. So it shows that the management is not really taking matters of occupational health and safety very seriously.
So after the February incident, because now this is getting quite concerning, the February incident where the ceiling fell on a staff member, was there any action?
Yes. Nothing at all, and we are deeply disappointed with this chronic disease of negligence that is happening at Tembisa Hospital, and it has to come to an end. Because I mean, we need to ensure that the workers are safe at work. Not only the workers, but also the members of the public that come to the hospital seeking assistance with medical issues.
Okay. If I were to ask you, because you've been looking at the matter for a long time, obviously it grabs our attention with the 2 fires in just a matter of days, but you've been dealing with the issue of the state of Tembisa Hospital for a very long time and have raised the issue. Why do you think it hasn't gotten the attention? You talk about negligence. Why do you? What is the reason that you put behind it? Have you given that some thought?
Well, we cannot pinpoint where the problem is. But I think when management habitually ignore important matters and there is no consequences on those kind of behavior, then it becomes a habit, and hence we are saying this must come to an end.
Okay. You've got Jack Bloom, for instance, who speaks for the Democratic Alliance, and he says 2 fires in just a few days is suspicious, and it's hard for one not to raise the fear that this may be arson. Is that something that you think is possible?
Well, that would need the relevant authorities to investigate and find out exactly what is happening. But from our side as workers, we are just concerned about the things that we are saying, the glaring non-compliance, the glaring things that are there that are not being attended to. That is what we are worried about, because our main concern and our obligation is to ensure that the workers at work feel comfortable and they are allowed to do their work unhindered and without any fear of anything that could endanger their lives. But anything else, I think it will need the proper authorities to investigate and get to the bottom of it. And we would encourage that kind of investigation to be done.
Yeah. If you'd allow me to read from the statement that has been put forward by the Public Servants Association. You say, the series of fires that have ravaged several government buildings in recent years pose a threat to the safety of public servants and undermine the integrity of national institutions. So here, really, we've broadened the discussion to not just what's happening in Tembisa Hospital, but, I mean, just expand on that. Maybe even, remind us of how many incidents we actually have dealt with, and then why we're seeing this trend and what you think needs to be done.
Well, as the PSA, wherever we are organizing, when the workers raise concerns, we go there, we see for ourselves, and then we report these issues to the management of the relevant employers. And if we don't get joy, we still go to the Department of Labor and Employment to seek assistance, and we confine our work to that, because our obligation lies with the workers. Anything else, I think it will need political will. If they see problems, they need to attend to those problems and involve the relevant authorities to investigate and get to the bottom of the problem and solve the problem once and for all.
Yeah, because, and I want to highlight some of the issues that you've raised. So, amongst many buildings, this is again reading from your very own statement, amongst many buildings affected by fires are the Parliament Building, the Department of Health's headquarters, the Department of Home Affairs building in Johannesburg, the Social Development Building in Durban, the Department of Education in Bloemfontein, you say the Department of Justice in Cape Town, the Labour Department building in Johannesburg. That's quite a list. What's the next step for the Public Servants Association, just as your last bite, and perhaps who your call to action is too, but some of the steps that you will be taking as PSA?
Well, we need to indicate that as the PSA representing the workers, we fully support the government in their developmental goals and to ensure that the rest of the country, the citizens of this country, get a better life. and also the workers at work are also comfortable to do their work. But if we continue to be ignored in this way, we are going to now approach the relevant we're going to follow the relevant dispute mechanisms. And if those don't work, unfortunately, we'll come to a point where we are going to take radical approaches, including strikes and marching and demanding now forcibly that the departments must comply with issues of occupational health and safety. And we do not want to get to that point, because we don't want any disruption of services, especially in the hospitals, where we understand that health are essential services. If we disturb health, we make our people suffer.
Yeah. Mr. Mautla, we really do appreciate your time. Madimetja Mautla, the Gauteng provincial organiser at the Public Servants Association.